All right, I'm sure many of you out there have heard dry January, right? When people voluntarily forego drinking alcohol as a way to recover from indulgences of the holidays, right? And for most people, that may be a choice that's easy to follow. For others, there is no choice because they suffer from substance use disorder. Volunteers of America of Ohio and Indiana is committed to helping people overcome their addictions. And here to share more in this sponsored segment, I'd like to welcome Jennifer Martinez. So good to see you.
So good to see you. Thank you for having me.
You know, I think people still see and struggle to see, I should say, addiction as a disorder rather than a choice. What exactly is considered then a substance use disorder? What falls under that category?
So the first thing is it's really important to understand that when we talk about substance use disorder, we're not just talking about illegal or illicit substances.
Right.
We're also talking about things like alcohol or prescription medications that a person might be prescribed for a legitimate mental health or physical health need. But when we get into the realm of substance use disorder, you're looking at things like increased tolerance, needing to use more of the substance to have the same effect, the substance interfering with your relationships as far as work, your family, and really interfering with those day-to-day obligations that you have.
Okay, so then Volunteers of America, how do you help people with SUD, you know, substance use disorder here in Columbus?
So we have been in the Columbus community for many, many years providing services to our veterans and to homeless families. And one of the things that we do is get them connected to the services they need around substance disorder and mental health. But we do have some new behavioral health programs that we'll be bringing online to the community in 2023.
Okay, so this one, I want to say Family-Focused Recovery Center.
Yes.
This is a new one we're talking about.
Yeah.
What are the goals for this center? Because it's very unique, I think, in the way that you guys are holding this. And
yeah, it really
cool.
is. We have 4 similar programs in Indiana that are very successful doing the same type of work. They're called Fresh Start. But this model really focuses on mothers who may be pregnant or they have children of, school age or younger. And our goal is to reduce the barriers for them to get into treatment. Having worked in this space for a long time, many mothers are reluctant to go to a residential treatment facility because they don't have a safe place for their children to be.
Yeah.
We're eliminating that barrier. They can bring their children with them to our facility, and we are going to provide services not only to mom, but to the children that she happens to bring along with her.
And talk about the importance of that on both sides, okay? So if the mom is able to have her children with her, if the children are able to remain with their mom, what does that mean for the journey into recovery? What does that usually, equate to in the end?
So we see that moms usually are much more motivated if they have their children with them. They have a sense of hope that exists when their children are there versus not with them. We're also really trying to prevent children from going into the custody of children's services or other family members. So, and for the children, it's just less disruption in their lives.
Yeah.
They've already had quite a bit of upheaval, trauma perhaps, a lot of instability in their lives, and this allows them to be in a safe space with their parent. We will have early childhood mental health services accessible. We will have age appropriate education opportunities available for them, and really we want to help the kids get back on track as well as mom.
And what kinds of services then? Is this just they stay there for a certain amount of time? Are there services after they leave? What kind of support?
We're going to have several different components, and it will be a continuum. It will not just be a one and done, because we don't believe that that's really what's best for mom and for the littles. So we will have a residential component that'll last up to 120 days, depending on each woman's individual situation. We will offer individual and group counseling, peer support, medication-assisted treatment, and we will do aftercare and follow up with them for at least a year, possibly 2 years after they leave our program.
And you actually got a direct investment from Humana and is supporting this, but our viewers can also support you, support your organization. Why, is that so important, and how do they do that?
It is really important because, Franklin County, we're very lucky to have a lot of resources, but we still can't meet the needs of the community. Yeah. And so if a person is interested in contributing to us, they can either go to vohoain.org and make a contribution there, or they can donate or shop at one of the thrift stores we have all over the community.
Okay, so that's easy to do, and supporting, just so many women in our community that need our help, that need us to lift them up. So it's amazing to do. VOAOHIN for OhioandIndiana.org. So thank you for being here.
Thank you so much for having us.